There we go. So I'd like to introduce today two members of staff from the Herefordshire and Worcestershire Health and Care NHS Trust. Correct? That's the right name. They took over the delivery of mental health services in Herefordshire in April this year. That's mental health and learning disability services, should I say. And previously, some of you may know that Together Foundation Trust delivered those services. So we've really wanted to ask them to join us today to give you an overview of how that transition has gone, what it is they're responsible for delivering in Herefordshire, and very specifically to ask them to tell you about some really exciting work that's going on and coming up for children and young people in schools. So I'll introduce the panellists and then stop talking and hand over to them. We've got Sue Harris, who's the Director of Strategy and Partnerships at the Trust, and Elaine Cook-Tippings, who's the Service Manager for CAMS in the Trust. CAMS is the Children and Adolescent Mental Health Service. So if I hand over to you ladies, basically, first of all, they'll outline some information they want to tell you about the work that's gone on across the Trust, and then we'll take some questions and answers. So you'll see across the bottom of your screen, there's a Q&A box. If you could put your questions in there, when it comes to taking the question and answers, I'll invite you to be able to ask your question out loud, and I can do something on the screen to allow you to do that if you want to ask verbally and if you're comfortable with that. Otherwise, I'm happy to read it out if you're not. Right, enough from me. I'll hand over to Sue and Elaine.
So, hi, I'm Elaine Cook-Tippings, and you'll perhaps know me because I've been around forever. So I now work for Herefordshire and Worcestershire Health and Care Trust, but prior to that, I worked for Gloucester Healthcare, 2G, Hereford PCT, Herefordshire Health Authority. So I'm sure I've come across some of you in my dealings with children and young people over the last 20 odd years. And my colleague Sue has worked in Worcestershire Health and Care Trust for much longer than me. So I'll just let Sue jump in.
Thank you. And just to say, there's been a bit of a glitch in some of the introductions. So if you lose me, I did come into the office hoping the broadband would be better. So yes, hi everybody. Sue Harris. I'm the Executive Director of Strategy. I've been with what was previously the Worcestershire Health and Care Trust for around 8.5 years, background in mental health, and have done everything from commissioning, voluntary sector, local authority jobs, etc., etc. So hopefully between Elaine and myself, we're able to give you a comprehensive update on as much of the developments that have been going on, specifically around the transfer, and then obviously more importantly the focus today very much being on the developments around the schools. So Elaine, you've got the slide deck, haven't you? So you are going to potentially share if we can get that working.
So Christine, it's saying that host disabled participant screen sharing. I have no idea what that means. Perhaps I could email the presentation to you, Christine.
You're on mute, Christine.
Just changing the settings for you now, Elaine.
Thank you.
And I suppose just while we're waiting then, I've actually worked with Christine for around 5 years. I've had quite a lot of dealings with the health and social care system at a Herefordshire and Worcestershire level. I do quite a lot on communication and engagement. So this is just a great opportunity to basically meet more of you, although this is a bit of a strange medium because we can't see you, although obviously you can see us. So that just takes some getting used to. So there's no way of reading a room as such. But yes, I've had some a long relationship with Healthwatch, and Christine had flagged that the schools schools, and obviously this was planned some time ago, pre-COVID, and I know it's taken some time to get into the diary. So if we sort of kick off then, do you want to do the first slide? So Elaine and I we're going to cover obviously a little bit about the trust, the services we run, the transition and the transfer in particular, and then we're going to move very much into the detail of the school's agenda, and you'll see there that's for Elaine to cover off where we are, what the programme looks like, the specific roles that sit within it, some of the ways in which that will work from a training point of view, and then some of the timelines around that programme of work. And clearly, as we've said earlier, please do continually ask questions to get through in the presentation. So just to say a little bit about the trust then. So the services transferred on the 1st of April. It had been in train for some time. A lot of that is to do with the way that the NHS organises itself and trying to make sure that Herefordshire and Worcestershire could work together as a collective. I just want to say thanks to all of the staff, and that would include Elaine, because you transferred on the 1st of April, and who could ever have known what that would mean. And to transfer in the middle of a pandemic where the IT looks different overnight, and that was all really crunchy, and we've got a lot of change happening across the county as well. All of that's positive, but I do think it was a bit of a melting pot in terms of everything we've asked the staff to go through over the last few months. So just to now we can get ourselves into a place where we all get all of the developments that we have across Worcestershire really working for staff, and obviously most importantly for the people that we support with mental health problems across the county. So just to say, some of this slide sorry, doesn't read quite right, but we obviously have got a collective population now of around 785,000 people with 4,500 staff, so it's a very large organisation with an income of around 200 million. In Worcestershire we also provide community services, so community hospitals, district nursing services, and a broader service portfolio around children and young people. But across Herefordshire and Worcestershire, in relation to mental health, we pretty much do everything from cradle to grave. Do you want to move on a slide, Elaine? So I just thought it was, and we use a lot of jargon, so if I inadvertently slip into that, and I'm sure Elaine will say the same, please put on the chat, what do you mean by that? We use mental health services as a broad heading, and actually beneath it is actually quite a complex tapestry, because it does include everything from children and adolescent mental health services, which is very much Elaine's portfolio. We've got a range of adult primary and community mental health services. We've got older adult mental health services. And we've got our specialist services, which are everything from beds, so psychiatric intensive care beds, inpatient. We've got a crisis response service, home treatment services, but we've also got very specific services that support mother and baby mental health needs, eating disorders, reablement and vocational support. So I suppose it just even describing area we would be spending the whole session. So it was really to say I wanted everyone to be aware of all of the services that we provide, and we can always organise specific sessions if you wanted to know more about some of these areas in more detail at a later point in time. Before I hand over to Elaine, though, it feels really important. Can I go back one, Elaine, just to quickly talk to you about the community mental health transformation. So you'll see there, second bullet point down, we've been working over the last few months to really look at a very different model of accessing mental health support through general practice, and it effectively takes out what was the old secondary care criteria. So mental health has always been organised through primary and secondary services, and in our world that is where you would step into a more specialist environment, and obviously particular thresholds and assessments have to be undertaken to something that's actually sitting in a more specialist sphere. It's been recognised for some time that that is not working well in terms of getting upstream, providing more targeted earlier support for people. It does sort of rely on a level of deterioration perhaps for people then to effectively qualify to go into the specialist portfolios. Mental health is changing rapidly. We're seeing new investment coming through to mental health. We've had that over the last 2 to 3 years. That is set to continue. We had the spending review highlighting that mental health will be a key focus in relation to NHS investment for many years to come, quite rightly, given the events of this year. So we've got some new money coming in, and it is really to put in new work. GPs working in groupings together. You've got 5 of those in the county, and it really is then about making sure you can get instant access through general practice to mental health support. Alongside that, there is some dedicated voluntary sector monies, and that will also embed an earlier response with link workers sitting in the teams in that primary care network, really offering a much more holistic earlier service to people than the traditional services that we've seen since mental health really developed all those years ago as a sort of specialism. So I suppose I just wanted to flag that, because although it was due to start in April, it was delayed and actually launched on the 1st of October. So it's still very, very early days, but it's important because it will really strengthen the way we work with families. So when are changing, we are seeing new investment, and that will give us some more rounded response. So although we'll talk about schools specifically, there's a lot happening in other areas, which is really about offering that more holistic service model to the whole population of Herefordshire. And obviously then we will see the schools agenda take shape as it moves forward over the upcoming months and years, and that will complement all that we're doing in other pathways around community mental health in particular. So that's sort of a real, obviously, canter through what we do, how some of the transition's gone, and we are still transitioning, and obviously building that backdrop of all of the change that's happening across mental health services in Herefordshire at the moment. So I'll now hand to Elaine to pick up the specifics.
Thanks, Sue. Folks, I can't see the chat, so I suggest that perhaps if you've got a specific question that you put in the chat, Christine stops me and buys one, and I'll try and answer it as we go, but obviously there will be time at the end for questions. Is that okay? All right, so I'm sure you're all aware of the green paper that came out a few years ago, because it was the most exciting thing, I think, that had happened for children and young people's mental health for many, 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 many years. It talked about a whole system approach to supporting young people's emotional well-being and mental health, and identified that there's a real gap in providing care to young people in the place they spend most of their time learning and growing, which is schools. The green paper talked about identifying senior mental health leads who had to be part of the senior leadership team, about a training programme, and actually since the COVID response, you've also had I think it's called the Wellbeing Return to Education or something like that, that's been sent in from the Department of Education. But the aim of the mental health in schools teams, which I'll call MHSTS from now on, is to provide additional capacity to deliver evidence-based psychological interventions to schools and offer better links to wider services. And the evidence-based psychological interventions is the key, really, because we all try our best to meet the needs of young people, and we all dabble a bit in support and counselling. But this evidence-based psychological intervention is it's what it says on the tin. It's evidence-based. We know it works. We know it has good outcomes. We know it's effective and good value to deliver. And we know that it's tested on the client group that we are delivering it to. So that's really exciting. And also we want the MHSTS in schools to support schools for that wider mental health agenda, to support schools to really, really think about mental health, stigma, and improve the well-being of the school, including school staff. So MHSTS are just part of that transforming young people's mental health green paper. So let me tell you where we're at. It's been a bit of a whistle-stop tour. Because COVID delayed all of the commissioning of these national projects, we only really got together maybe June time to see if we wanted to put a bid in. And we've got a project group which has got education, commissioning and health colleagues on. It's also got representation from public health. We submitted our project plan to NHS England and it was agreed, thank goodness, in September. We've been recruiting staff. There are a lot of staff to recruit. We need 32. And if you've ever met me in a corridor, you'll have heard me grumbling about the fact that CAM staff are hard to find. We engaged with the schools that the target, the project target, the target of the project met. So we did an expression of interest to those schools in July, and we chose placement schools based on our education colleagues' advice in September. Our trainees have started. They're doing their university course as we speak today. And we did a welcome event with our placement schools just last week. I think I've seen a couple of questions just buzz in. Do they need to be answered now, Chris, or can we wait?
No, it was just asking if we can share the slides.
Of course.
So I've said that would be fine.
Of course. I'm also aware that I've been living and breathing mental health in schools teams for the last 6 months. So there might be chunks of information that are missing. So if people want to contact me outside of today, that's absolutely fine. I'll do my best to answer your queries. So here's the recruitment. We needed 16 trainees who I think are kind of similar to your higher level TAs. And we recruited all 16. We had an amazing response to our advert. We had 108 applications in 2 days. So we had to shut our advert early. We interviewed 36 and have got 16 excellent practitioners. We've got 5 of the 8 supervisors and 2 of the team managers and 2 of the clinical leads. We still need to get 3 more supervisors, an overall service manager so I can get back to my day job. We need a project support coordinator, which is a really exciting post, and we need some administrators to keep the rabble together.
Elaine, we've got a couple of questions at this point. Do you want to wait till the end of the presentation, or?
Shall I try and answer them?
Yeah, so the first question is, who are the schools that are initially involved? And the other question is asking about the evidence-based interventions and what are they?
Okay, so the schools involved, let me start there. Each mental health support team has to cover a school population of 8,000 children once they are up and running. So this first year is a training year, year 2 is up and running. In discussion with our education colleagues, it was felt that the senior school, the secondary school population fell reasonably easily into that 8,000. And also looking at data from our education colleagues, so Les Knight and co, that secondary schools would probably benefit most from this project at this time. So we sent expressions of interest out. I think there might be a slide about this. And our Herefordshire schools are Earl Mortimer in Leominster, Queen Elizabeth in Bromyard, Ayleston in the city, and John Masefield in Ledbury. Okay, so that's the schools. So in year 1, our trainees will be placed in those schools. So of those 16 EMHPs, 4 are for Hereford. But in year 2, they will spread wider around the county. And then the second question, I've already forgotten, Christine.
It was asking what were some of the new evidence-based interventions.
That's right. So the evidence-based interventions are mostly CBT orientated for low to moderate anxiety and mood disorders, and also some evidence-based parenting interventions to support families who are looking after children and young people who are thought to be challenging. So based on some very social learning approaches. I think it's the Incredible Years programme, some of the Triple P programmes. There's a new programme, a Kathy Creswell CBT-based parenting intervention, but it's mostly CBT. I hope that helps, but please ask at the end if you want more information.
Before you move on, there's another question asking about the schools that missed out on this first training year. Will they have an opportunity to have a practitioner next year?
Okay.
When you say it will broaden out, will it include all of the secondary schools?
It'll include all of the secondary schools. So if you can imagine, we're going to be rolling out that team. So in Herefordshire, we're going to have 4 education mental health practitioners, 2 senior clinicians, and 1 very senior clinician for the Herefordshire population. It's still not a massive amount of staff, but when you think about the size of Herefordshire CAMHS, it's quite a substantial group. So they will roll out to the whole of the county. However, that will be very thin. So we're hoping that NHS England are going to enable us to bid for more mental health support teams in Herefordshire, so we can actually cover a wider population. There is a suggestion from the CCG that that is very likely. So although we've only got 1 team in Herefordshire at the moment, it will very likely roll out to more teams, and I'm hoping that they will cover primaries in the future. Is that okay? So this slide is really busy, so you'll want to read this when you get the slide pack, but it talks about the evidence-based practice. So here you are, individual face-to-face work, brief low-intensity interventions for children experiencing anxiety, low mood, friendship or behavioural difficulties based on evidence, and group work using CBT for children who have anxiety. And then there's going to be the group parenting, I hate the word classes, group parenting interventions to include issues around conduct disorder and communication difficulties. So that'll be interesting. We'll also be supporting the designated senior mental health lead in each of the settings to provide targeted help, as well as think about the whole school approach. And we'll be giving advice to schools and college staff to escalate up. So these staff will enable you to access Tier 3 CAMHS if that is required, or signpost you to other organisations, enabling good transitions. So I'm really hopeful that that clunky bit in the middle where you have to send a referral form into CAMHS and then it gets rejected because we haven't quite asked the right information of you, I'm hoping in the future that won't happen. I'm ever an optimist.
Elaine, we've just got another question
Yeah.
and the question's from Carolyn Quinn, and she's asking why you've chosen to use higher level TAs as opposed to qualified counsellors for the roles.
So we haven't chosen to use high level TAs. The advert went out with a very broad person spec, and it asked for experience of working with children, young people and families, knowledge and experience of common mental health conditions that young people might experience, and a willingness to undertake the university studies. So actually, we've also got some counsellors in the 16. We've actually also got some qualified teachers who fancy a career change in the 16. So, and some social care staff, some school nurse assistants. So it's, when I use the example higher level TAs, it's more that that's kind of the level that we're employing these people at, rather than those are the staff that we targeted. Okay, so the principles as outlined in the project plan, but also the national guidance, is that you need local governance, that the support is additional to, not instead of, existing support. We need to be completely transparent and share our information with our local project board, and that we need to be responsive to schools' needs, not a one-size-fits-all. I always laugh at this kind of thing because NHS England and Health Education England are very specific in the project aims, but they also tell us we need to be really flexible. So as you know, in Herefordshire, we're always flexible and creative as a system. So I'm really hopeful we can meet everybody's needs. One of the interesting things is that young people should be able to access the support all year. So some of the schools that were successful in their expression of interest were able to explain to us that they had summer holiday clubs and venues that could be opened over the summer holidays for group work and therapy to continue. So that's really good news. It doesn't stop when the school term stops. It's really important that we co-produce what we're doing with young people and families who will use the service. And these services are supposed to reduce health inequalities and educational disadvantage. So being placed in the schools means that people aren't affected by travel time or travel poverty. I know a big issue for us in Herefordshire is broadband and Wi-Fi accessibility. Again, being placed in the school reduces the risk that young people can't access the service. And here is our Education Mental Health Practitioner, EMHP. They're currently trainees. Each team must have 4 of these staff, and although they are CAM staff, they are actually based in schools. They start as a band 4, which is NHS lingo for around £20,000 salary. And when they qualify after a year, they move to a band 5, which is equivalent to a nurse qualifying. Once they're trained, but also during their training, they get supported very intensively by a trained supervisor. And as I've already said, they have to deliver the evidence-based interventions, identify mental health needs, support and facilitate staff to identify and manage issues, and help young people within the settings who present with more difficulties to rapidly access those more specialist services. We're really aware that this is going to be challenging. I think our biggest challenge is that we've got this lovely, fabulous golden resource, but only in specific schools. And I'm quite uncomfortable with that, but I'm really hopeful that it is the start of something bigger. Schools need to play their part. So the schools that were selected were able to evidence that they had infrastructure that would support the project. They had a regular on-site presence. Something really simple, they had a room available that the therapist could work within. They were happy to engage with the project team to plan and identify needs of young people. And the mental health lead had been allocated and was up for it. So just going on a bit more, schools need to induct and orientate the trainees. And they need to be able to meet with the senior mental health lead on a really regular basis. They need to be able to assess children and young people. When we've been talking to our national colleagues, they have suggested that they've struggled to find children to be assessed and get intervention, which I find absolutely amazing to believe. So we'll see what that looks like in Herefordshire. I am sure you've all got lists as long as your arm of young people that you'd like to access this service. So I don't think we'll have a problem finding young people for these people to assess. They need to be able to deliver the interventions because they're assessed on their ability to deliver them and do not pass their training unless they can evidence that they're competent in these things. We need to get referral pathways within school, and we also need to make sure that our safeguarding pathways are aligned. And we need to be able to communicate with not only the mental health lead, but the whole school community, your governors, your parents, your facilities staff, about this role. We're also linked with Northampton University, who trains our EMHPs and also our supervisors, and they're very experienced to help us overcome any barriers that we find locally. I've seen another couple of questions ping up, but obviously can't see them.
We've had a comment. Sue's just commented in the chat about the challenges around the money not necessarily providing full coverage, but actually this is where other work in mental health across the transformation project actually complements this work. And the other question is one from Ian Stead, and he's asking if there'll be anything in this programme that's specific for young carers.
So yes, as part of our bid, we had to indicate what special interests, if you like, we might have as a wider mental health support team. And in Herefordshire, I think carers were young carers was one of our target areas to really focus on how we can support young people manage their caring responsibilities whilst being a child and learning. And also in Herefordshire, we were thinking about how we could meet the needs of young people who experience care but might not meet thresholds for traditional CAM services. And somewhere along the line, I think we also thought that we might target young people who are having gender identity issues or young people who identified as LGBT. I hope that answers your question. So the education settings need to identify their mental health lead. They need to help us involve their young people to design and set up the teams. The boring bit is that they need to engage fully in monitoring and evaluating the programme, because as with anything in NHS England these days, I'm sure it's the same for you guys in Department of Education, everything has to be monitored and evaluated in order to evidence that further funding is required. We need to ensure that the messages that these teams will complement rather than substitute existing support. So if schools contract with local counselling services to provide a counselling service, what we don't want to see is that that counselling service is then decommissioned because MHSTS are coming in. We want this to be extra and additional instead of. And this is the accommodation bit. One of the biggest stumbling points nationally is that schools haven't been able to provide space for group work and one-to-one sessions. We've heard all kinds of stories about people having to do sessions in playgrounds and in broom cupboards and all of that. Herefordshire also has a very traditional school estate, doesn't it? Lots of schools are quite old in their fabric and perhaps aren't laid out quite as we would like, but the schools that have been selected to be placement schools have all identified that they have got appropriate clinical space, so that's good news. Right. There we are. So that's a whistle-stop tour, but as I say, I am completely aware that all I think about is mental health support teams. So there will be bits that I know that you don't know. So if you want to ask me questions now, or alternatively, Christine can share my email address and you can drop me a line. That's not a problem. There's also there's also a link at the end of the slideshow that Chris will circulate, which is the link to the green paper and the Future NHS collaborative platform, which has got loads of info should you be interested.
Thanks, Elaine. That's really helpful to get a bit more detail around the project, and I hope other people feel as excited as we do that we're seeing investment in mental health across children and adults, and hopefully in time this will lead to an increase in the provision potentially for primary schools, because we know from previous forums that we've held for the schools forum that that's a real issue and a big area that you would like addressed. On that note, before we move to questions, we're currently working with the CLD Trust to bring you another webinar in January, which will focus on the work that CLD Trust that complements CAMS and this sort of work. And they also do some work in primary age range as well. So there'll be an opportunity to hear lots more about the good work that the CLD Trust do alongside this. So if you want to raise your hand, I think that's an option in this format, or equally you can put your question in the chat and I will invite you to speak out loud. So we've got a question from Ian. This is where it tests me to do the technology properly. I'm going to allow Ian to talk. So there we go. So Ian, would you like to ask your question? You're on mute, Ian.
Hello, can you hear me?
Yes.
First of all, just to say thanks for Sue and Elaine. That was really interesting and incredibly encouraging that we're going to get this development, and obviously we look forward to seeing it spread even wider. My question was, is there any way that students and pupils can be involved in this process? You know, Health Watch have helped to set up Youth Watch in John Curl, and there's been a group of very enthusiastic students who've been sort of go-betweens and ambassadors and talking to their schoolmates about this and trying to help to get rid of stigma, etc. I was wondering if that can be developed through this process.
So perhaps I'll jump in here. co-production is a massive part of this. In the first instance, I think it will be based pretty much in the teams, in the schools that the teams work with, but we're also aware that there's lots of other young people who are really motivated to change services and make them suit them, because let's be honest, we're all not as hip and young as we all were, and young people need to tell us what they want. Health Watch, the Youth Health Watch group have in the Tier 3 CAM service, so that's good news to evaluate our service. But I think longer term, we will be rolling out much more widely, because this project is to meet the needs of Herefordshire children, not just the ones that attend the schools that are in the first year.
Yeah, thanks. That's really helpful and very encouraging. Thanks.
Thanks, Ian, and thanks, Elaine. We had a question submitted in advance from Carl May. Carl, do you want me to bring you in and you can ask your question? Are you there?
Yeah, I'm here. Can you hear me?
Yes, we can.
Hi. Yeah, I'm the owner of a business that helps people with their mental well-being, and I've worked with Mind and Macmillan over the years. And I was just wondering, is there any scope to use business like mine to help the huge workload that is coming up, and the speed of actually giving support once diagnosed?
You want to take that one, Sue?
Do you want me to go? Yeah, I'll pick up that first off then. I've been absolutely, Carl, there's a bit of a sense of all hands to the pump, isn't there, really, from now right for many years to come. I think I've been struck that through COVID, we really have started talking about resilient communities, health inequalities. We've often talked about those in the NHS, but it's never really taken the momentum at the front and centre stage of all of what we're doing. So what we're starting to talk about, we're definitely going to see an impact in children and young people as well. So the conversations we've been having are very different in terms of what the NHS does well and how it works with the sector and other organisations to really make a much more rounded response. So it isn't all about the work coming into the NHS, it's heading it off at the pass. Or if people have been diagnosed and supported, how do they get supported ongoing to stay well? And obviously we've been working a lot with Mind around the immunity mental health transformation, very much starting to talk about then how does that become a catalyst for doing more work, which is actually about joining things up to support people with mental health problems, but isn't traditionally about funding the NHS to do it. So it is feeling different. I think if you wanted an answer sort of in the here and now, we obviously are a provider, so that would be a commissioning conversation with the clinical commissioning group. But I think my take as one of the executives in the system is that we will be talking about how can we really mobilise organisations in the sector, and I think we are also going to be talking very much about how we don't end up compounding health inequalities, which arguably we have done through COVID, though obviously it was nobody's intent to do so, but we have, and we've probably created new ones. So for mental health, we're listening and learning about those experiences, and we're working through what do we need to put in place? How would we get a workforce, given that, as Elaine's already flagged for CAMS, it's true for mental health overall, it's very hard to recruit to registered mental health nurses, and has been for some time. So we've got to think very differently with very creative solutions that bring all of that kind of, opportunity to look at how we stitch together the different services that we all provide so that they can turn around and meet people's needs and ideally support people so they don't need to stay in the NHS or come into the NHS in the first place. Elaine, anything you wanted to add?
No, I think you've done beautifully there, Sue.
Thank you both, and thanks, Carl, for that question. We've got two more questions, Richard Kelly and then Katie Eastall, so I'll just invite Richard to ask his question. Richard, can you unmute?
Yeah, I have unmuted. Thank you. Thank you very much, Christine. Thank you, Elaine and Sue. That was very interesting. I just wanted to ask, given that there is a history of each of our schools in Herefordshire doing their best over the last few years to support mental health and well-being in schools. They, of course, have all taken different routes to do this. And I just wondered if you'd given consideration to how you're going to work as a kind of a cohesive team with different approaches taken by different schools, and whether you thought that was a problem.
Hi, Richard. As I said in our presentation previously, having worked in Herefordshire forever, we are very creative and resourceful, aren't we? We can stretch things to go long ways, and we have I call it like a patchwork quilt kind of approach, which is brilliant and very responsive. But as you say, pulling it across to make it consistent can sometimes make it a little tricky. Within each school that is part of the training placement, and then later on, there will be a project board, if you like a subgroup of the bigger project board, where all the players in that school economy will congregate to make sure that they meet the needs of that population of young people in that patch. We've then got our senior clinicians and managers that will manage all 4 teams, because there's 3 in Worcestershire as well, so 3 individual teams, to ensure that we've got some consistency, whilst acknowledging that Kidderminster and Redditch are very, very different to rural Herefordshire. So I think we want some consistency in the delivery of evidence-based practice, but we also need to acknowledge that schools have been functioning uniquely over a long period of time, and we don't want to stop that because it works, but we need to make sure that there is some equity. We will be working with the local education authority as well to see what other offers can be made available to try and bolster up perhaps some of those schools who haven't had the resource or the flexibility to provide a wider range of facility. So it's early days, but I'm really keen that we have consistency, but that allows flexibility and creativity. So that's a bit of a fluffy answer, but I hope you get where my heart is.
Thank you.
Thanks, Richard. Thanks, Elaine. I'm going to bring Katie Eastall in now. Katie, would you like to unmute and ask your question?
Have I done that correctly?
Yes, we can hear you.
Good, good. It was really a question around Ofsted and how they are involved or not. Our experience at the Cart Shed is that schools have been very good at saying, much as they'd love to send somebody to us, they can't because Ofsted doesn't like us. And as Richard implied, different schools have different ways of doing things. So some have interpreted coming to the Cart Shed as a registered day, so that qualifies as a day at school. And other schools are saying absolutely not. If you go off-site, you're it's a day away from school, and ultimately there are Ofsted penalties, which actually isn't the best thing for the young people at all. So it was partly how is Ofsted and the rules Ofsted have are going to be applied. And then I suppose it's the non-school provision that might be available in terms of what the referral process might be, and making the best of what we've got within the community. You know, as you say, we're very rural. That different people will respond to different settings. Sorry, a bit garbled there.
No, I get where you're coming from. I don't know the specific answer to the Ofsted question, but I will take it back to Les Knight, who sits on the project board. Chris Baird has authorised, if you like, if that's the word, he's co-signed the agreement that this is a multi-agency children's workforce provision. And so I'll defer to them. I'll find out if it's okay, and I'll ask Christine to then disseminate what I find out for you, if that's okay.
Yeah.
with regards to working with partners, one of the really important roles of the MHST is to find out who else is out there, what is provided, how that is funded, all of that kind of thing, to create almost a contacts directory, if you like, to signpost. And I wouldn't be surprised in the future if some, not necessarily right away, but in the future, some MHSTs are not completely NHS. So across the country, in Gloucestershire, for instance, the MHSTs are a joint venture between the NHS and a voluntary sector counselling organisation. So there's nothing to stop the further development of MHSTs being partly NHS, partly voluntary sector, you know, made up of a whole range of partners. And again, in Herefordshire, that might suit us because we have lots of agencies who provide a wide range of support. I hope that helps.
Thanks, Elaine. I think what's interesting there for me is thinking about different styles and approaches, and there not being necessarily a one-size-fits-all approach that's out there for different children and families.
Totally.
I think,
and this is in addition to, not instead of.
Absolutely. That's great. Has anybody else got any questions? I can't see any in the chat or in the Q&A, and we've got about 13 minutes left of Sue and Elaine's precious time. So has anybody got any questions they'd like to ask?
I wonder also do people know about Couth, which is something else that came online on the 1st of April along with COVID? Do people know about it? So it's an online signposting, advice, forum, counselling provision for young people that is self-referral. I know that our Couth partners are trying to engage with county schools, but again, in these COVID times, it's really tricky. So if people want to know more about the Couth offer, Kooth, maybe our rep could come to one of these meetings, or she could come to one of your schools and tell you about what's on offer.
Yeah, we did include it in the bulletin that we sent out a couple of weeks ago. So when we send out the recording and follow-on information, we can pop it in again, just in case somebody wants the link. We've got somebody's hand up. I think it's Ian again, so I'll just allow Ian to talk. Click, there we go. Are you there, Ian?
Hi, yeah, thanks. Yeah, I was interested, well, a couple of questions really. One was just a practical one of, will you be able to keep us in touch with how it develops? So as it's going along, it'd be really interesting to hear that and hear what's being learned from the different places and how that can be spread around. And I was also interested in how this fits in with the sort of wider mental health system and services, because there will be young people going into the system, I guess, through lots of different routes. And I wondered how that all gets joined together so that a school knows that a young person has got involved in the system somewhere else and not through your system, so that it's all joined up properly.
Okay, well, if I answer the communications question first, we are thinking that a newsletter would be a really good idea in these early days to circulate to all schools, whether part of the placement school or not, just to describe where we are with the project, what we're learning from other places. Do people know of young people who want to be involved in the co-production? Do people want to let us know of directory contacts, that kind of thing? One newsletter is just about being put together, so we'll be circulating that this side of Christmas, so everyone should get that if they're linked to a school. With regards to fitting into the system, we walk a fine line, don't we, with being transparent and sharing knowledge and information whilst also maintaining young people's confidentiality. So I think we need to think about that. I think we need to grow communities from the school settings that we're working within, and probably have some information sharing. I don't want to say agreements, that sounds too formal, but some kind of information sharing plans. Obviously, if young people are at risk, we've all got protocols to follow to escalate that. But I think we need to be really careful because we've got to maintain confidentiality. So it is a fine line, and I think that's one of the areas that one of our more senior practitioners will need to think about when they're in post, which hopefully won't be too long.
Yeah, I mean, thanks. You can see how, if that isn't right, that it could create difficulties, because you wouldn't want a school, for example, taking certain actions because of their understanding of the situation, when in fact there's something else going on, and the two things could potentially clash, and it would be quite important to know, you know, from both sides of the story, really.
Yeah, and I think because these teams, although they sit in education settings, will be linked into CAMS, there will be some element of information flow. So hopefully that will be minimised, but there is always that risk, because again, we're all doing our own creative and flexible things, aren't we? And there's little pockets of magic all over Herefordshire.
Yeah, and I was thinking as well, we've got people like CLD who are working with a similar population, and again, I think, you know, giving some thought to that kind of liaison might be worth doing.
Definitely, definitely.
Thanks.
We do have Alex from CLD on the call. Alex, I wondered whether you wanted to join and say something. Let me just try and find the allowed to talk. There we go. Are you there, Alex?
Yeah, I think I'm there anyway.
Yeah, we can hear you. Yeah.
Hi. Yes, obviously we work really, really closely with CAMS already. We take a lot of referrals from CAMS, and we are also in a lot of the schools. Actually, we're in, I think, 6 of the secondary schools now in Herefordshire, and we have more and more sessions there. And I think what's important is what Elaine said about this being additional. And I think that's really clear, because we do need more in terms of schools being able to support the young people who need that help. So I think that additionality is the thing, and we are more than happy to actually, you know, work even more closely in terms of this work, so that we can tailor all that in and keep providing what we already provide, and work closely with this initiative, which is hugely welcome. That's our view here anyway.
Yeah, that's great, Alex, and we look forward to the session that we're going to do with the forum in January to hear all about the work of CLD, Strong Young Mind. Fantastic. There's a comment in the chat about Cooth being obviously an online offer, and that some young people are resistant to an online offering. I was just wondering, I know that the Health and Care Trust have done a big survey of young people over the last few months, and I wondered if you could say a little bit about the findings and whether there was anything, any strong themes around different modes of access that you heard about. Sue?
Yeah, you're right. We did a joined up piece of work with the council, actually, and it was specifically looking at children and young people's mental health and well-being. Started quite early on, actually, probably in my late April, early May, and we got around 800 responses. I think we probably have to recognise that we were also doing a survey at a time when the schools were shut and the kit was not as readily available. We weren't so was not really being used in the NHS. It had converted mainly to telephone, though I think it was a mixed bag. Obviously, some people found it very difficult to use and to build a relationship up with their practitioner, and others actually found it very useful, and things like Cooth were very well thought of prior to COVID, but there was always going to be a group, like Katie points out, that it's just not going to work effectively for them. So I think what we also heard was quite a lot of pressure being taken away from some children not being in school, but equally lots of concerns about missing out on education and the pressure that might put on them when they did return back into the education settings. So at that point, it was really helpful, because it but obviously we've had real challenges in restating face-to-face appointments. Some of our buildings don't work well in terms of infection control and distancing, but we do know that for a lot of young people, there is that first face-to-face assessment is quite difficult to do through the medium of either video or telephone. So there is a prioritisation in that way. People are also quite worried about confidentiality. You know, where are they going to find a safe space at home to be able to have the conversation, whether it was either through the video or the telephone, and that created challenges. A lot of people saying I don't have the privacy in my own home to be able to do this, and so there's been some work as well with the council about the distribution of kit, or making various settings available for young people to come into, just so they've got that privacy to be able to engage, even if actually that isn't face-to-face, at least they could be on the computer in a safe have had in relation to the feedback. We are doing another survey piece of work to just get underneath some of those issues, because April, May does feel different to now, especially now children are back in school. But I guess the piece for me is we don't know where this is going to end up. You know, there'll be some parts of this new way of working that will retain and remain in the NHS, but exactly how much to do what for whom, we're still learning, talking, listening to try and understand what that might mean. Elaine, do you want to say a little bit about how it's been for yourselves in CAMS around that experience of the digital agenda and young people?
Elaine, are you there?
I am sorry, my internet went funny just as Sue finished. So what was the question?
So we've got a few minutes left.
Okay.
Sue was wondering if you had any comments from your experience in CAMS around the digital agenda and how it's been going.
Well, I'm always interested in culture and behaviour of staff. That's sort of my special interest. And what I found interesting was that sometimes staff really struggled with the transition from face-to-face to remote more than some of our young people did, perhaps because we're older and not very tech savvy. But as time has gone on, our staff feel that they will keep part of virtual working as part of their offer. So that was a real shift for me. I don't know if Sue had said that in her summing up, but there was a lot of resistance, and it wasn't all about families and children. I think we can fairly comment that staff really struggled too. And of course, Herefordshire broadband is pretty awful at times.
Yeah, absolutely. I think COVID's have been a big learning curve for everybody in some way, shape or form. And none of us have been immune to broadband issues. We've got literally 1 minute left, so we probably haven't got time for any more questions. I think what we'll do is share the slides. We'll share the recording for the members of the forum who haven't been able to come. Is there anything from you, Elaine, as a parting comment that you might want the forum to consider for the future in terms of the work that you're doing?
I think that I've always wanted to be as accessible and as available as possible, which has been difficult over this period of time with the merger and COVID. But I've put my email in the chat because I really don't want anyone concerned about CAMS or access to CAMS. So if people can just contact me with any kind of quibble or query, or sometimes it went really well, Elaine, that would be really helpful, because I really want to make sure that we can work together as a community rather than tit for tat. So if people can contact me with anything, that would be great.
Great. So it's 2 o'clock and I can hear my dogs at the door, so probably time to call it a day. I just want to say a really big thank you to Sue and Elaine, because it's really good to have an opportunity to ask questions and to hear about the work. And I'm sorry about the dogs, and we'll send all the information out in a newsletter. So thanks everybody for joining. Bye.